Okay, think about the medical technology that we all rely on, right? From pacemakers keeping hearts beating to the software that helps diagnose diseases. It is incredible stuff. It saves lives, literally every single day. But that power brings up a really fundamental question. How do we know it's safe? How do we actually build trust in the very technology that's supposed to heal us?
Well, here's the thing. From a super simple thermometer to the most complicated life support machine you can imagine, every single one of those devices has some level of risk. And managing that risk, it's this critical, mostly invisible, behind-the-scenes story that makes sure the tech designed to help doesn't end up hurting. So that's the big question, isn't it? In a world where nothing is ever 100% safe, how do the people making these devices build a system we can all trust? How did they make that crucial call that a device is safe enough to be used on you, or on me, or our families?
So here's how we're going to break it all down. First, we'll look at that constant tug of war between a device's promise and its potential peril. Then, we're going to pull back the curtain on the global safety blueprint they all follow. We'll see how they literally hunt for hazards, how they tame the risks they find, and finally, why safety isn't a one-and-done deal, but a lifelong process. All right, let's dive right in. At the heart of all of this is a core concept. Every single medical device is trying to find a balance between its amazing life-saving potential and its potential to cause harm. You know, the people who write the global standards for this stuff, they put it very bluntly. There is always some risk involved. Even after a manufacturer has done everything they possibly can to make a device safe, there's always going to be some leftover residual risk. And the crucial part is, that little bit of remaining risk is only okay if the medical benefit is big enough to be worth it. So, how in the world do you manage this systematically across the entire planet? Well, the answer is a global safety blueprint. It's called ISO 14971, and you should think of it less like a book of boring rules and more like a universal game plan for thinking about and managing risk.
And this framework is honestly incredibly thorough. It guides a manufacturer through every single step of the process, from finding anything and everything that could go wrong, to figuring out just how bad it could be, to putting controls in place, and then, and this is so important, watching over it for the entire life of the device, from the first sketch on a napkin to the day it's taken out of service. So, how does this whole process even start? Well, it all kicks off with a hunt. I mean, a serious, systematic hunt for every single potential source of harm you can possibly imagine. The standard itself calls a hazard a potential source of harm, and that word, potential, is everything. Think about it like this. A patch of ice on the road is a hazard. It's not hurting anyone, just sitting there, right? But it has the potential to. The harm only happens when a car drives over it, loses control, and crashes. That's the difference. And this shows you that critical chain of events they have to think through. You start with a hazard, let's say an inaccurate sensor in a smart thermometer. That can lead to a hazardous situation. The thermometer tells a worried parent their sick kid has a normal temperature when they don't. And that, of course, can lead to real harm. A dangerous fever gets missed and treatment is delayed. Manufacturers have to map out this entire chain for every single thing they can think of. And the scope of what they're looking for is just huge. It's not just about sharp edges or obvious mechanical failures. A hazard could be a type of energy, like an electrical current where it shouldn't be. It could be chemical, maybe a tiny trace of a cleaning solvent left behind. It can even be informational, like a device just giving you the wrong number. Okay, so once you've got this giant list of everything that could possibly go wrong, what's next? This is where the action plan comes in. This is about taming the risk. First, they have to define what risk actually is, and it's basically an equation. You take the probability of something bad happening, and you multiply it by how bad it would be if it did. So, for example, a total system failure that's almost impossible is still a high risk because it's so severe. But you know what? A small glitch that's guaranteed to happen to every single user, that's also a high risk. They have to manage both. So how do you control all this risk? Well, the standard lays out a really strict hierarchy, a pecking order. The number one top priority is always to just design the danger out of the device completely, make it inherently safe. If you can't do that, then your next best option is to add protective measures, things like alarms or safety shields. The absolute last resort is to just provide information, like a warning in the user manual. Think of it with a car. Making better brakes is always better than adding a seatbelt, which is always better than just a warning light.
So, after this whole process, after all the redesigns, the shields, the warnings in the manual, any risk that's still left over is called the residual risk. Which brings us to the real million-dollar question, because you can never, ever get to zero risk. So, how much is okay? When is it acceptable? And this is the final judgment call. The manufacturer has to formally analyze and write down exactly why the medical benefits of their device are worth that final leftover risk. A small residual risk might be totally acceptable for a heart-lung machine that's saving someone's life, but even a moderate risk probably wouldn't be okay for a device that offers only a minor benefit.
But, and this is so important, the process does not stop when the device gets boxed up and shipped out. Not even close. Which brings us to our final piece of the puzzle, the long watch. The key word here is actively. Manufacturers are required by the standard to have a system in place that is actively gathering intelligence once their device is out in the real world. This means they are listening to feedback from doctors and patients, they're monitoring their own production lines, watching their suppliers, and they're keeping up with the latest scientific research and even how similar devices from competitors are performing. What this really means is that the safety plan for a device is a living, breathing document. It's never truly finished. If some new, previously unknown hazard is discovered 5 years after a device hits the market, the whole process kicks off again. The risk gets reevaluated and new controls are put in place. Safety isn't just a snapshot in time. It's a commitment that has to evolve right alongside our knowledge. And, the standard itself is incredibly direct and honest about this. It states right in the text that absolute safety in medical devices is not achievable. And that frank admission is really what sets the tone for this entire philosophy of managing risk. So at the end of the day, the goal isn't this impossible dream of zero risk. It's about something much more realistic and, frankly, much more powerful. It's about building a system of trust. A trust that's based on a tough, transparent, and continuous process. And that process is what allows us to be confident that when we need it most, the technology that keeps us healthy is as safe as it can possibly be.